Hi, my name is Dr. Priyanka Desai Pilani, co-founder Ashok Clinic. We are glad that the MNC guidelines are finally out. This was something much awaited. So all these years, most of the patients, were a little skeptical to go ahead with these procedures, considering the safety part and because of, certain unfortunate accidents that they've been always hearing. But now, with these safety guidelines, where the medical practitioner is supposed to perform the procedure and not assistants and technicians, that will build up a lot of confidence on a lot of patients to go ahead and opt for these kind of hair transplant surgeries. But I think what we feel is, instead of the partial procedure, being done by a medical practitioner, it would have been even better if the guidelines mentioned that the entire procedure throughout, from the extraction to also the implanting part, was performed by the professional surgeon only, which would have, a much safer and a more quality and a result oriented approach. So looking good and youthful is something which has been a human desire, and over a period now, we have seen this change, that something back then at 10 years ago, technologies were not so advanced, the awareness was not so much. So now, if you see most clients of all age groups, somebody at 20 as well as somebody at the age group of 50, being professional in their fields, being the working people, also a lot who are into the social media platforms, they want to transform themselves, they want to look younger, they want to look better. So now there is a more professional approach towards, treating the baldness in the hair industry. So more and more clinics and good organizations are developing over a period where professional surgeons are, giving these services and transforming the look and boosting the confidence of the patients by giving wonderful hair restorations with the advanced technologies. Now when we see the latest advancements, something which we saw 10 years ago, more procedures were heavily invasive and purely surgical, because of which the pain factor, the safety, the downtime, everything was more. Now, when we see things have advanced over a period of time, procedures are very minimally invasive. So overall now the process is smoother, simpler and safer compared to what procedures used to happen 10 years ago. Also, with the advancement of technologies, when we see now the overall experience of the patients in terms of the pain and also the aesthetic part of it, now if you see the beautification and the overall restoration of the hairline and the overall hair growth is much more natural compared to when you saw certain case studies 10 years ago, when the final outcome was a little, a little artificial, not aesthetically as appealing as it is today, and also lesser painful with quicker recovery and very much comfortable for the patients to go through the procedure without any kind of major maintenance or hassle in their routine life. So as of today, the biggest challenges that we face, in the hair industry is because the market is huge, so we should be well researched and we should know, what technology and what approach we are going for, because a lot of cheaper options are also available, but definitely the damages that are caused are not reversible. So we have to make sure that entire procedure, has to be done by professional surgeons, because now if we see in the market, the biggest challenge is you have lesser qualified people, maybe, not the right kind of approach is there, because it's the technical team and not the actual professional surgeons who do the entire procedure. So that is something which is very important, because this is a very critical job which needs that level of skill, precision, accuracy for a good quality transplant. So definitely we must make sure and research these things before we go ahead with any kind of procedure. Also challenges in terms of, the side effects, because post procedure you should opt for techniques where there's minimum downtime, and you don't want to go with aggressive sessions like, one day of 10 hours, 12 hours of job, because that's where the pain factor, the overdose of anesthesia, the side effects, the wounds, the healing, everything can get complicated if not done well. So I think systematic multiple session approach, you go with professional doctors, then definitely the, the quality, and it will be more result oriented job. Being a health practitioner myself, and Dr. Abhishek Pilani, the co-founder and the dermatologist, we were very keen and passionate into the beauty industry and the hair restoration. That's how the first clinic of Assure was set up in Mumbai, which is our headquarters, and gradually then we expanded to multiple locations within Mumbai, and now pan India we have 14 centers. So from a small clinical setup of just a team of 5, we are now expanded to a team of 200, and with 2 to 3 surgeons who are on panel with us, now we have a very senior professional team of 40 surgeons who are working for us under the brand of Assure. And with the initial 2 to 300 patients where we gave a successful restoration and results, now we have a good 18,000 plus happy patients who have undergone these hair transplant procedures under the brand of Assure. I think our main aim when it comes to giving quality and satisfaction to every patient, that is where the brand has grown and emerged and become so popular over a period of time. Also, we're very happy to announce that Assure is going international. So we are the first Indian brand who is launching the center in Dubai, and we have plans in next 2 years to have complete expansion in GCC as well. So Dubai would be launched in the next 3 months, and within 2 years we'll have 6 more centers coming up in GCC. And Fiducia Capital is somebody who's going to be funding us, and Mr. Satish is has joined us on board. And within India, we are having expansions to another 10 to 12 locations. So we are having international as well as pan-India expansion that we see in the next 2 years.